Jennifer Adobiabuahene. She's a health promotions officer, Ghana Health Service. We're talking about the polio vaccination drive. Good morning, ma'am. How are you?
Good morning. How are you too?
I'm well, thank you for asking. So what is the polio vaccination drive all about?
Okay, so the polio vaccination exercise that is ongoing is like a mop-up.
Okay.
We did polio vaccination in the last quarter of 2024, and we realized that after every vaccination, we have a team that goes around, and the goal for those vaccinations are to immunize the target group. Okay. So for the polio vaccinations, always the target groups are children below 5 years. So after the vaccinations we did in 2024, we realized that some districts still had children that were missed. Yes, children that were not vaccinated.
Okay.
So we have to do it again. So this one that we are doing is being done in 3 regions in Ghana. So Ashanti region, Greater Accra, and Central region. And we have just some selected districts where we found out that a lot of the children were not vaccinated. So those are the places we are doing it.
Okay, and is polio still around?
Polio, so when we see the virus in the system, then we have to do the vaccination because it's highly contagious. And then we've come a long way since 1988 or somewhere where Global Fund started supporting the eradication of polio. Okay. We've been able to achieve 99% reduction in the cases of polio. So we are very cautious. As soon as we see the presence of the virus, then we have to build the immunity of our children so that no one gets infected. I'm sure you know polio cannot be cured. No. It's not treatable. So we only manage the symptoms of it. So we don't want, and it can cause severe deformities. So we don't want that. So that's how come as soon as we see the presence of the virus, then we have to do the vaccinations.
You said 3 regions. Which regions are those? Greater Accra is part of it, right?
In Greater Accra, we are doing it in Ablekuma North. Okay. Accra Metro, we have Ayawaso East and West. We have Gas South, Shai Osudoku, Gas Central, Tema West. So these are the districts that we are doing the vaccination. And in these districts, we are expected to vaccinate all the children within the district. So we are encouraging caregivers within these districts that, yes, we've done it again. So for this district, this will be like the 3rd time we are doing the vaccination since the last quarter of 2024. Okay. So we want everyone to avail their children below 5 years. We started from the schools yesterday. Today, this morning, they will be in the schools, and then we will move to the house to house. The goal is to vaccinate every child below 5 years.
And so what are parents to look out for?
So all they have to do is just avail their children below 5 years, and it's oral vaccination. Okay. So you just bring your child, open their mouth. We've had instances where our caregivers will get to homes, and our vaccinators will get to homes, and then the caregivers will say the children are sleeping, or maybe the parent is not aware. So we want to ask caregivers that, or parents, if you are going out, since we are doing this exercise, you can give the caregivers the permission. Sometimes you go and meet nannies, grandparents, aunties who are taking care of the children, and they say the mother hasn't given permission. So we want them to give the permission. If they want to be there themselves, if the nurses have past your area, you can bring the child to the facilities. Okay,
so you have centers where they can come to.
So all the health facilities within these districts, the private and the government health facilities. Once you go there and you say you've heard that it's polio vaccination, the nurses around can get you someone who vaccinates your child. Okay,
so and how do we identify your officers? Your personnel.
Yes, so the nurses are in the communities. Most of them will be wearing the Ghana Health Service at our t-shirts. Okay. And then we have those who have the yellow apron, the polio vaccination boldly written on it. We have aprons that they wear, yellow ones. Some will wear blue, the supervisors, so you see them. Yes.
And how do we know that they are not imposters?
We've never had issues of imposters. Okay.
But you never know.
Yes. I know people have to be very careful. Yes. So if you are not convinced, you come to the facility yourself. And then we want to say that every child must be vaccinated. Okay. So people shouldn't exclude their children. The vaccines add additional protection. I've said that the polio infection cannot be cured, we can only manage the signs and symptoms. So we want everyone to be vaccinated. And if you have a child that is below 15 years that has started experiencing weakness in their arms and their limbs, we want you to bring the child to the facility so that we can check the child out. We want every child to be healthy and be able to move physically. Yes.
Okay, and remember that if you don't vaccinate your child and he or she gets it, it may affect other people
children,
too. So please avail your children
yes.
To be vaccinated.
And we know that lots of the children, most of them don't know these hygiene practices, especially below 5 years.
Yes.
So it's easy for them to catch infections, especially from the schools. You don't know who may have not been vaccinated. Some schools, they will tell you that vaccinations are compulsory.
Okay.
I know some schools, when they are doing admissions, they take your child welfare book. It's a requirement. The parents must bring it for them to see all the vaccinations you have before they admit you, for the protection of other children and your child too.
Okay. All right. Any final words?
Yes, so my final words, I would like to encourage everyone, when you give birth and the nurses tell you to come for weighing, we should not miss it. And we should come early because the child welfare clinic has a lot of packages. So we have to come early so that we can learn and know how to take care of our children. Most of our parents or the caregivers miss the weighing centers. They only come rushing and bring their children just for vaccination. They don't listen to the education sessions, and later you find them having issues that they can handle themselves, but because they don't have the knowledge to, they find themselves in some problems. You hear a lot of complaints about caregivers saying, my child doesn't eat. That is the common one we hear a lot. But when you come for weighing, we have a way of counseling you and guiding you on how to go about it.
All right, okay. Thank you so much, ma'am, for joining us. We're grateful for your time. Jennifer Adobia Boahene. She's a health promotions officer at the Ghana Health Service, and we spoke about the polio vaccination drive. So please, if you have children under 5, right?
Below 5, yes.
Children below 5, and it started yesterday, 27th, and it's going all the way to the 2nd of March.